Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. I'm very pleased to have Natalie Sales with me here today. Natalie has been a pharmacist in Phoenix for almost 20 years and is also a licensed insurance agent who specializes in Medicare and prescription drug plans. Her passion is to educate and serve the over 65 population. Natalie, welcome to the show.
Hi there, nice to be here.
All right, so why don't you give us a snapshot of the pharmacy side of your life first?
Okay. I was lucky enough to be a stay-at-home mom for 15 years. And when my youngest was going off to kindergarten, I needed to figure out what I was going to do. So I decided I would just try and get into pharmacy school and become a pharmacist. So I was able to get into school, and I graduated with my PharmD degree the same month that I turned 40. So this has been a later in life career decision for me.
Okay.
So I've been a pharmacist now for 18 years, worked in retail right out of school, like most people do, and ended up in the compounding field, which I love.
Okay.
I've been a compounding pharmacist for 12 years now, working in the beginning with human drugs. And I now, in the last almost 7 years, have been working strictly with veterinary compounding.
Oh, wow.
So that's been an even smaller niche within pharmacy that has just been amazing. We love our animals, and
Yes.
During COVID, when so many people were laid off or couldn't go into work, I was going into work every day. Nothing changed for me. I was very lucky to have this job and be able to serve and continue to, make medications for everybody's pets. So I've been in this field of veterinary compounding for the last, like I said, almost 7 years. In the last 4 years, I made the transition from working actually in production and, helping to get the scripts out the door, basically, to the more regulatory and compliance side of the business. I've learned so much stuff that we just don't learn in pharmacy school, right? It has nothing to do with the drugs or talking to doctors or counseling the pet parents. This is all the regulatory stuff that has to go on behind the scenes, that I am the person now in my current position that makes sure that we're compliant. And because we are compounding and literally making these medications in our pharmacy, we have to follow all the same rules that we have to for human medications as well. So that's what I do now. My official title is pharmacist in charge. Every pharmacy has one, and I am licensed within Arizona and also in over 20 other states. And each board of pharmacy of those states, I'm the person that's linked to this pharmacy. So if anything goes wrong, it's my license.
It's your license, right?
Yes. When the boards of pharmacy come in to the pharmacy, I'm the one who leads the inspections. I'm the one who has to provide them with all of the documentation.
Right.
So that's what I'm doing now, and it's been a great career for me.
Okay. It sounds maybe on the stressful side, being the one who's responsible for everybody else, but
it can be.
But you seem to be at peace with that.
Yeah, the way I look at it is, it's what they're paying me for, right? They're paying me to make sure that we're compliant and that we're inspection ready 24/7, because the inspectors will just show up whenever they want. And and I have to be able to know what's going on. I've got to be able to stay cool. You have to know how to answer the questions. You need to know how much to say and when to stop talking. And it's definitely been an education.
Okay. And you mentioned that's not something they teach in the traditional curriculum. Do you enjoy that part of it compared to the rest of your job? I mean, I'm sure you wear the most hats there if you're doing the
It's interesting because I feel as though being on this side of the business, I'm regulatory and compliance. I really have not been working as like a pharmacist for the last 4 years that I've
Okay.
been on,
So
doing this.
mostly sort of backroom sort of paperwork stuff.
Yeah, and it's a lot of having to know all of the state regs, knowing the, when it comes to like the DEA stuff, all of the federal laws that, we have to have in place, making sure that our policies and procedures are all compliant and that everybody in the building is following them. So it's different, and I do miss working with patients sometimes. I do miss working with doctors and helping answer their questions and guide them to knowing what to prescribe for their patients based on their meds, based on their symptoms, and especially with compounded meds, because we can do whatever the doctors need. We can combine certain drugs, and we can do different dosage forms if it's for a baby that needs, let's say, a heart medication that doesn't come in a liquid that a baby would be able to take. That's where compounding really is so specialized, and that's really how pharmacy started, right? It's the little apothecary on the corner. So yeah, I do miss those days, but this has been very interesting as well.
Okay. Now, can you talk a little bit about how it seems like this is well suited for dealing with the regulatory stuff with the pivot for helping or the insurance work and helping other people. Can you talk about how that happened and where you're at?
Sure. So I've been doing insurance now for the last 7 years. We have a family agency, and my cousin owns an insurance agency that deals strictly with Medicare. And she just, we both started out in the late 80s. We got our insurance licenses at the same time. We worked together for a year then, and she continued and created this amazing agency, and I decided to get married, have babies, stay home, and then I've come back around to it, in my 50s. So I just decided, she was like, Natalie, why don't you get your insurance license? You talk to people all day long about their drugs. You could be really helping them and helping guide them towards the right drug plans. And so I did. I got my insurance license, and, here and there she would send me people, and then they send me people. And I, every year during open enrollment, they asked me about their medications and what the best plans, if I could help them find the best plans. And so that's kind of been like my side gig for the last 7 years, but I am really moving more and more towards doing that. And a little bit away from my pharmacy job and spending more time on my Medicare business and growing it, because it's very satisfying to be able to help a senior look at what their drugs are and find a plan for them that will save them sometimes thousands of dollars a year. And that's what most people spend the most money on as far as their healthcare goes, is their drugs. So it's been very satisfying to be able to kind of move and shift into this business that I just kind of saw as a side gig, to be able to spend more time doing that.
Well, it's a very complicated industry, and you seem to be well situated for helping people navigate those waters.
Medicare's a lot.
I'm wondering, unfortunately, it's difficult to I've been trying to envision the compensation model for you, because it's very valuable, the service you're providing, but because it's probably not a billable service. So can you talk about that?
Of course. So it doesn't cost the senior or the Medicare beneficiary anything to work with me. Let's say I find them a plan that is the best plan for them. That's United Healthcare. So I'm contracted with all of the big plans, in town, right? In Arizona. And then I'm also licensed in California. If I enroll a client in a United Healthcare plan, United Healthcare pays me. And then Medicare sets the rates. So whether I put them on a Cigna plan or United Healthcare or Aetna, I get paid the same for all of them. So I'm not biased towards one plan over another. I truly am. Yeah, I'm looking to find what is best for my client. And and then that's how I'm compensated. So it doesn't cost them anything to work with me at all.
Excellent. Excellent.
Yeah.
And what's the best way for you to grow that business? How do people find out about you?
Well, word of mouth. And now that I'm trying to, spend more time doing this business.
Okay. Now that you're giving it your proper focus and attention.
Yes. I'm going to start, my partner and I are going, because I do have a business partner who I work with. He and I are going to start doing educational seminars, like at senior centers, at libraries, awesome. And really start marketing that way. And, if we can get out there and provide some value to the seniors, just learning about Medicare, right? If you're 64 and you know that it's, next year you're turning 65 and you could either stay on your employer coverage or go on Medicare, well, we can help answer those questions about, do you have to sign up for, that's the biggest question. Do I have to sign up for Medicare? Everybody knows about these penalties that could potentially happen, or can you stay on your employer coverage? So we've already put together these seminars and we're just in the process of getting them scheduled.
Excellent. Excellent. Yeah. So very exciting, new venture for you. Do you have a name and a website and everything to direct people towards?
Well, we do. It's called Premier Care Retirement Solutions. Okay. And we are actually in the process of having our website built right now. Okay. So, yeah. So hopefully we'll have that up soon, in the next couple of weeks, maybe month or so. But yes, that's what it'll be called, Premier Care Retirement Solutions.
Okay, excellent. So at this point in your career, right, it's nice to start to have control over your days and your time, right, while still doing something meaningful. It seems like you've been able to balance that pretty well so far. Are you excited to take on a big project and how long do you see? I guess I'm wondering about your, not just, I like to ask people about their New Year's plans, right? And their 2025 goals, but in your case, I think it's more about your 5-year, 10-year. How are you planning on growing this? Can you share sort of your plans for that?
Oh, well, it really is real. I think our biggest plan for Premier Care is just trying to get out into the community. I've grown up in Phoenix. I've lived here since I was 11 years old. And, I've got friends who live in other parts of the country that are these smaller towns, and you can really feel the community when you go there. And I never really had that feeling here in Phoenix. But what we want to do with this Medicare business is create that community just wherever, whether it be here in the area where I live or anywhere. We just want to be able to get out and meet people and really educate them. I think for me, as a pharmacist and being in healthcare for so long, I counsel patients all day long. That's what I used to do before I started working, even in veterinary medicine, before I became, into this side of the business. Our pet parents would come and pick up their drugs and I was talking to them. That's what I've done, is educate my whole career. Right. So really, I feel like, yes, I can help somebody get on a plan and I can make money from that. But my main goal and our main goal is to educate. Like you said, Medicare is confusing for anybody. So everybody really needs to have a Medicare person. They really do, to help them navigate and understand and make the right decisions. So 5 years from now, 10 years from now, I see it being amazing, like being able to help people, having seminars, but also being able to take time off whenever I want and control my days. And if I'd like to go up and visit my daughters who live in Oakland, I can take my computer and have, meetings up there like this and still be able to take care of my clients, not being tethered to one place all of the time. Right. So that's what my vision is for us.
Okay. Okay. I imagine there's seasons of busy.
Yes.
Okay. And you can grow a team out for I imagine a lot of these clients, 65 and older, have documents they want to share with you so you can see stuff, or is it easier to do in person?
A lot of clients like to meet in person. Okay. And to be perfectly honest, I do too. right? It's so nice to meet somebody, to sit across the table from them.
Right.
I mean, this is great. This is, COVID has really made this the norm. And I think it's great. It's fantastic. But it's really nice to be able to meet somebody, shake their hand, feel their energy. A lot of these seniors allow us to come into their homes. So I'm also meeting their spouse or meeting their dogs, and it's great. And so, yes, we would prefer to actually meet in person with our clients.
Okay.
But we can do this as well. We do a lot during, you mentioned seasons. The end of the year from October 15th through December 7th is open enrollment for Medicare beneficiaries. And that's the time when I can take a look at their plans, look at their medications and their doctors, and make sure that the plan that they're on is the correct plan for the upcoming year, because a lot of these plans will change their benefits. So we're really, really busy during open enrollment, which is, like I said, in the fall and early winter. So that's when it's super busy. But, people are turning 65 every day. So those are the people we're hoping to get out to and reach during this other time of the year,
Right. Well, it's not just, every year they can change too, right? It's not
for sure. A
special, they turn into a pumpkin if they don't do it on their 65th.
No, they don't. There might, if they're working and they have employer coverage, there's no problem. But if they decide, I don't, I'm not going to take a plan this year or whatever, after they turn 65, there can be some penalties involved. But for the most part, people know, that they need to sign up for something when they turn 65.
And like you mentioned earlier, medications are a big part of the health plans nowadays. And I forget what they call it when the list of drugs that insurance specific,
the formularies.
Yeah, the formularies can change from year to year, and trying to switch to different versions of something for price considerations, it can be a huge deal for some people. Incredible value that you help people figure out such a complicated thing, but also monetarily.
That's what's so satisfying, really, because a lot of seniors are on very limited income. And I can use my mom as an example. She just had to go to the emergency room and had something go on. And now the doctor has prescribed a very expensive medication for her. And this is a big deal, when it's hundreds and hundreds of dollars a month. And you don't see an end to being, the doctor doesn't say, oh, I'm just going to put you on this drug for 3 months. This could potentially be forever, and I can take a look, and this is what we do. This is what our clients will reach out to us every year and say, we ask them, what's your drug list? What pharmacy do you go to? And then depending on what kind of plan they're on, I can also take a look at their doctors to make sure that their doctors are contracted with that certain plan. And then I can tell them how much their drugs are going to cost in 2025, and then, or whatever the next year coming up. Sometimes we save them, like I said before, thousands of dollars, because this one plan will be the only plan that will cover that one medication, and none of the other ones will, and we'll be able to put them on that plan. And I can't tell you how thankful these people are, really.
For sure.
Yeah. It's great. Let me tell you, it's fantastic. I like my day job being a pharmacist, right? But the regulatory stuff, nobody's telling me and thanking me and giving me hugs when I walk out of their house. You know what I mean? When I'm doing this,
it's nice to get that once in a while.
It is. It really is. It feels really good. So, and I know I'm doing something. I'm giving back, and that feels good too.
Right.
Yeah.
Yeah. That's my wife's favorite patient population as well. She
really,
she gets along well with the older patient population for sure.
Yeah. They're great. Really.
Yep. And to your point, often more grateful nowadays for your time and attention and help.
Yep. And it's very sweet. I'll tell you, I have clients who will ask me several times during this last open enrollment. I had probably 3 different clients who were referred to me, and I did the workup and I looked at their drugs, and I determined that the plan that they were already on was the best plan for them. So in essence, I'm not getting paid because somebody else put them on that plan, right? They were just coming to me to have me do a review. And they were like, well, Natalie, but we want to pay you for your time. And, I'd say to them, no, you can't. First of all, you can't pay me because I get in trouble for that. But people are just so grateful and they're thankful. Right. And when they find out that when I've done this and I sit down and I tell them, nope, you need to stay where you are. And then they feel badly that, I've taken that time with them. So I just tell them, just send me referrals. So when your brother turns 65, make sure you give him my name,
Right. Yep.
So, yeah.
It all comes around.
It does. Sure. Absolutely.
For sure. Okay. Now I have a technical question for you real quick. Before open enrollment comes around, do they give you the next year's formularies? Are they all ironed out?
So that's a good question. So technically, open enrollment starts on October 15th. Mm-hmm. We get privy to all of the numbers on October 1st. So
you have months to figure it out.
Oh, right. Yep. No, we have. And so, yeah. So hopefully we have all of our clients' information prior to that. And we have made our appointments throughout, October, November. But yeah, we don't get the numbers until the 1st of October.
Okay. Now I have another technical question for you before we wrap things up. Is obviously maybe a generic version of something might work for them. You can save some money on them, but the compounding nature, can you speak a little bit to the powers of the compounding for costs? Compounding different prescriptions, good and bad?
Well, a good example of that right now is all the weight loss, right? Okay. The Ozempic and
semaglutides.
The semaglutides, yes. So I just had a client tell me that their Wegovy was priced out at $700 a month at like a Walgreens, right? Now, if the doctor were to take that script and call it into a compounding pharmacy, they could get it for about $250 to $300 a month. Wow. So it's the same drug. Now, but a doctor cannot prescribe a compounded medication simply for cost. You can't. Like as a compounding pharmacy, we cannot make Wegovy, a semaglutide, in the same exact dosage. So let's say it's 2 milligrams per ml. We can't do that. It's got to be more than 10% more or less. Okay. And so the way a doctor will call it in is they'll make it a different dosage, a different strength. And if they want the patient to have the same as like the Wegovy, they'll just say, okay, give them half a mil. They'll make it stronger, prescribe it to be like, let's say 4 milligrams per ml, but they'll prescribe that they only inject a half of an ml to get that 2 milligrams. Right. Is that too technical?
No. The games we play. Like okay.
12 too, right? Because that's good for diet as well. And so they'll make it a combo drug. And that's how, I don't know if I should be giving away these traits.
Sure.
But that's kind of how it happens.
Okay.
Now, as far as like I mentioned before, a baby needing a medication, that, a cardiac med that's not made for peds and it's only made for adults, we can take a tablet.
Not liquid form. Okay.
Right. And that will generally be more expensive, to be honest, because we're making it special for that one patient. Right. And most insurances don't cover compounding. They don't. So, when clients are buying their medications through a compounding pharmacy for human meds, they're paying cash, but you can also use your HSA if they have an HSA account. But like for where I'm at now with veterinary meds, that's all cash out of pocket. Okay. But like I said before, we're all crazy about our pets, so people pay it. It's a good business.
Right. Okay, I have a side note to add on that. I heard, and I believe this is as far as completing your prescription, taking all your meds, that people don't follow through on taking their meds. If the doctor says, here's a course of antibiotic or something, people are prone to taking like a fraction of them and then they die off. They feel better, they get distracted, whatever. But when it comes to their pets, they will absolutely follow the protocol and do it religiously. And so pharmacological treatments of pets is far better than for humans.
Yep. People are much more compliant. It's crazy. And you're exactly right. They start, if they're sick and the doctor gives them an antibiotic, after a couple of days, they feel better and they figure, oh, well, I don't need it anymore. And then they'll stop. And that's not good because they haven't really killed off the bad bacteria in the body. It becomes resistant to the antibiotics. And then you have to take an even stronger one next time. And that's how that all happens. But the way that people are with their animals, oh no, they're very compliant usually.
And I would think I've seen that this isn't meant to be a joke, but it's a kid was giving a donut to the dog and they're like, oh no, that's terrible for the dog. And then eat your own donut. They're giving donuts to their children, like that's healthy. And then, but not for the dog.
Yeah. Well, I wouldn't doubt that, to be honest. I don't know about letting your kids eat that, but them eating for the pet owner themselves, maybe, but who knows, I mean, we all know chocolate's bad for dogs. So maybe it was a chocolate donut.
Sure.
It's not that bad for the kid, right?
Okay. So reflecting back on your journey, what do you wish you would have known sooner about building wealth or success in your career?
Oh, I will tell you, I wish that maybe I would have thought a little harder about what I chose as my career. It was all very flip and just kind of just a real flip decision that I made. And don't misunderstand me. I love being a pharmacist. I'm so happy that I've chosen this profession. But I don't know that I would have gone and done as much retail as I did. I probably would have just gone straight into compounding. I knew that's what I loved when I was in school. And so that maybe I could sit here and say to you, the last 18 years, I've been a compounder rather than spending, the first 5 or 6 years in retail. But we all have to kind of cut our teeth when we come out of pharmacy school. And the best way to be broken in is working in a Walgreens or a CVS, because that's a real hard and fast education into pharmacy.
Is it? Okay.
Yes, it is. Yep.
Okay.
So I guess that's kind of what I wish.
To maybe do a little more research and be a little more intentional with your time. Okay.
Yes. And it's interesting because today I was interviewed by 2 pharmacy students that are doing rotations with some of my peers. And I always close out with that. I always say to them, when you're doing your rotations, because they put us in our last year of school where we go and do 6-week rotations in different settings.
Right. And
I tell them, pay attention and see what lights you up and what makes you excited about pharmacy, and pursue that, because it's real easy to choose this because they're offering a real big bonus or it pays more than this one, but you want to be happy, and these kids are young coming out of school and it's a demanding profession. And 20 years from now, I tell them, when you're my age, you want to be happy with what you're doing. So be aware of what really makes you happy. So that's good
advice too, right there, is just, and it may change over time too.
Absolutely.
Right?
Oh, you're right.
Yeah.
Yep.
Yeah. Stay in touch with yourself.
Yep.
Okay. Excellent. Well, Natalie Sales, if people want to connect with you or learn more, what should they do?
Oh, well, they could email me at natalie@premiercare-rs.com.
Okay. And also on LinkedIn?
LinkedIn, just Natalie Sales. I'm there. LinkedIn, Facebook. Like I said, we're putting together all of our social media for Premier Care. But yeah, if they search Natalie Sales, I'll come up.
Okay. Excellent.
Yeah.
All right. Well, thank you everybody for listening and watching. Thank you very much, Natalie, for joining me today. We appreciate you sharing your stories and your insights into success and pharmacy and compounding and helping people with their insurance here and creating an impact for sure.
It's been great to be here. Thank you.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.